so they know no matter what, they're in the right place. But there's actually more upside than they inherently thought. So that way they're not just kind of halfway there, halfway doing their exercises, not being compliant with it. Because no matter what, the two alternatives are framed of their benefit. It's better recovery or not even needing it. And so you're going to have a much better client. You're not going to have the client who you know is just, they're sitting there, they just know they're checking the box. I'm here, I only have 8 more visits, I'm going to have surgery. Your therapist hates that patient, and the patient hates therapy, and it just doesn't cause a good actual synergy there. But if we have better conversations, we can have better patients. We can turn someone from a not so good patient into a really, really good patient. And then what else we can do there is we can turn someone from a skeptic to a raving fan. Because if you can take someone who was diehard surgery to the fact that they didn't need surgery, they actually got better and they're actually stronger doing all the things they thought wasn't even possible. So you get the patient who says, my doctor told me I needed this, but I think I need surgery. So a lot of people don't really know how to actually overcome this objection, or what happens is they schedule, they no-show, you end up having issues there, or they show up, they're awful patients for your PTs because they're just there because someone told them to be there. And so there's things that we actually need to do to really kind of start this from the get-go. So that way we don't end up losing money or just having a bad experience, because we want to make sure that your therapists are actually seeing people that want to be there. And so just so you have context, I'm Dr. Joey Albritton. We work with around 275 clinics around the nation, and we've helped train hundreds of front office staff at this point. So we've got a lot of reps at this. We've listened to hundreds of call recordings. We've really gone through the gambit here. And so I want to save you some time here and give y'all a better opportunity to actually help this person get them better results and potentially prevent them from having to have a surgery that maybe they don't need. And so on this, the real thing that we're kind of really trying to figure out is they don't really think that the service vehicle that we're kind of doing, which is physical therapy, is the most beneficial. In this case, they think that surgery is actually the best option. And so we need to start to kind of figure out what this looks like for them, why they think this, and really what did the doctor tell them on why they needed physical therapy. Because there's the doctor who prescribed 2 times a week for 4 weeks so they can 100% just have surgery and just doing it for insurance causes. There's the doctor who's doing it because they think that they could actually get better and they don't need surgery because maybe they're a little bit more conservative on their stuff. And so there is a different nuance, and y'all should over time learn the doctors that are referring to you that are more conservative versus the ones that are like straight up just hitting their guidelines so they can actually get insurance to cover it. And so the thing that you really kind of need to do here is, again, always acknowledge whatever they say to you, because if we don't acknowledge that, then what's going to end up happening is they don't feel heard. They feel like they're in the wrong place. They feel like they're maybe the crazy one here. And realistically, it's actually a valid concern, because in their head, physical therapy doesn't make sense, because if I need surgery, why would I do stuff ahead of time? So they don't understand pre-having something. They don't understand that if maybe it needs surgery, then how could it also be solved with physical therapy? And so since they don't know this, we need to kind of figure that out. So it's like, I understand you feel surgery is the right solution for you, but out of curiosity, did your doctor give you any reasoning for why they recommended physical therapy? And so then at that point, if they're like, okay, like, yes, they did give a reason, it's like, okay, perfect. I agree 100%. Most patients don't realize the importance of prehab. That way we can really do everything before surgery to make sure that your recovery is faster, because we're strengthening, we're working on flexibility, all those things, because all of the research shows that you're actually going to have faster recovery from all of this. So you'll be in a good spot. So that way we can go ahead and get you taken care of, because I assume you're not just wanting surgery to not actually get good results there. So I'm glad that your doctor thought about this. I'm glad that you're here now. You're in the right place. So there's a lot of things that I just kind of did there. I threw in research normally shows that makes people feel like they're making the right decision. We said you're in the right place. We talked about the doctor actually saying this. We agree with this. Most patients, so they're in the norm. Like, people want to be like the norm because they feel like in numbers, there's more security there. And then at that point, realistically, we can get them scheduled a little bit more at that point, because really it's we don't need a ton. It's just we need that for sure validation of why we need to do it. It helps them in the back end, and it's not just we're doing it because of insurance and everything like that. But the more common one is the doctor doesn't actually tell them anything. And so what we actually want to kind of walk them through is, it's like, no, they didn't give any reason or anything like that. It's like, okay, so really there's 2 potential outcomes with this. So it's, you come in, we actually start working on everything. We start working on strength, range of motion, mobility, and it just leads to a smoother recovery. So that way, instead of having to be off from work for X amount of time, we can actually shorten that and or just get you back to even faster where you're wanting to go, so we can go back to XYZ. So depending on whatever they said on the previous one. The alternative is actually a lot more common than a lot of people actually think, is we do the same thing. We start getting better, but then you're like, hey, I don't know if I really need surgery. Like, I'm starting to feel like I haven't felt in a while. I'm starting to feel stronger. I can do the things that I wasn't able to. And there's a lot of people that can actually bypass the surgery, bypass the deductible, bypass the pain of all of that type stuff, and we just cancel the surgery. And then maybe it's 15 years down the road, you're like, okay, maybe we get to a surgery or something like that. But that way you're going to be in a much better spot, so you don't have to worry about that and have to really deal with all of this. And so for this, I think no matter what, you're in a good spot. You're in the right place at the right time. And so really, let's go ahead and get you scheduled so we can go ahead and get everything rolling here. And then we'll just kind of play it by ear. So it's like, hey, if you're doing good, like, please let us know, because I'm sure no one really wants surgery if they don't have to. But if we're like, hey, we're for sure having surgery, you're just going to be in a much better spot. So that way we're going to recover a lot faster. Does that sound fair? Like, yes, that does sound fair. And then you can go ahead and get them scheduled. And so I know that some of these, like, we don't really necessarily hit pretty commonly, and they will cost you lots of money if we do not hit this. But we also need to be pre-framing the fact that there is the option of no surgery, because if they're pretty dead set on surgery, that's only because they think it's the only option, not because physical therapy. Yet to meet someone who's like, yes, please, surgery me, cut me up, do all that type stuff. I want to hit my deductible. Like, it just doesn't happen. And so we want to pre-frame the fact that that can happen. Like, they're already like, oh, I didn't even know that was an option. So once we start to do that, if we hadn't pre-framed that, they'll just still get a surgery despite getting better. And so if we're always doing that and checking in, testing, retesting, doing all that type stuff, we'll know if they're actually going to be a candidate for someone that doesn't need physical therapy. But if they don't even know it's an option, congratulations, they won't take it. And so we have to walk them through that so they know no matter what, they're in the right place. But there's actually more upside than they inherently thought. So that way they're not just kind of halfway there, halfway doing their exercises, not being compliant with it. Because no matter what, the two alternatives are framed of their benefit. It's better recovery or not even needing it. And so you're going to have a much better client. You're not going to have the client who, you know, is just, they're sitting there. They just know they're checking the box. I'm here. I only have 8 more visits. I'm going to have surgery. Your therapist hates that patient, and the patient hates therapy, and it just doesn't cause a good actual synergy there. But if we have better conversations, we can have better patients. We can turn someone from a not so good patient into a really, really good patient. And then what else we can do there is we can turn someone from a skeptic to a raving fan. Because if you can take someone who was diehard surgery to the fact that they didn't need surgery, they actually got better and they're actually stronger doing all the things they thought wasn't even possible, they're going to refer everyone and their mother. And you're not going to worry about, okay, well, maybe that's one person that didn't go to surgery or whatever, and the doctor maybe is like, oh crap, they got better. They're going to refer literally everyone and their mother. You're going to make so much money off of that person, because it's one thing to take someone who already kind of believes it and then you get a good result, but someone who's like diehard, I don't think this will work, it's not for me, to then getting them better, you will make dividends on that person, not to mention, of course, just the impact that you made on that one person. So if you found this helpful, we've got a full sales series that we're coming out with. And if you want even more kind of curriculum based, we show you everything for providers, front office, all this type of stuff, or you even want us to customize this based on any of the objections that you're getting, we have a school group where we have all of these trainings really easy for you to digest. You can ask us questions. We have 2 coaching calls a week, so where you can literally hop on and be like, hey, I'm getting this specific objection. This is what they said before. Let's role play. Like, we'll go straight through it, solve these things. So whether that's your front office, whether that's your providers, or maybe that's you, we can help you on all those type things. So hopefully you found this valuable, and I'll see you on the next one.